So this is how we can calculate the risk for preeclampsia in all the trimester. We should go to this website fetalmedicine.org. In that, calculators, and we have to click on prediction of preeclampsia. On the left hand side we can see all the 3 trimesters prediction of risk, and in that we will click on the third trimester, that is 30 to 32 weeks column. After clicking that, drop down menu will be open. Now we are supposed to enter all the relevant details like gestational age, singleton, twins, height, weight, racial origin, whether there are any risk factors or not. So we are creating one hypothetical situation in which we are entering everything as normal. Now we will be entering the blood pressure of both the arms, and the software will calculate automatically the mean arterial pressure, and then we will enter the uterine artery of left and right side, the PI values only, and we routinely do not use the PLGF and SFILT as these are newer markers and our patients cannot afford, so we will not use that, and we will click on the calculate risk. Now see, the FMF software will give us the risk calculation based on the history, based on mean arterial pressure, uterine artery PI, and then it will give recommendation that based on this findings the patient is considered as low risk for development of preeclampsia before 36 weeks, and the risk should be reassessed at 36 weeks. So we have entered 34 weeks in this case, and now we will see what happens if we change only the uterine artery pulsatility index, that is uterine artery PI value. We will keep in the next example everything same, height, weight, gestational age, and everything we will keep same. We will just change the mean uterine artery PI value. So now we will click again on the same option and enter all the details as it was previously entered, and now you will see that just changing the uterine artery PI value slightly. In the previous case the average mean uterine artery PI value was 0.8, and in this scenario we will see, we will enter the blood pressure as it was in the previous case, and now we will enter the left uterine artery PI. I will keep the same, and only right uterine artery PI I have slightly increased the value. Now the same patient will be considered as high risk for development of preeclampsia before 36 weeks. So more attention and more frequent surveillance can be considered on this patient. So this is how can we can predict the risk of preeclampsia in our own practice by simply entering the relevant data, and we just have to have correct uterine artery PI value.